At the Challenging Case Symposia at our major meetings, there are generally two types of presentations. The first was the one that was spotted in the office, the hypermature cataract, where the concern is for the dreaded Argentinian flag sign. Or maybe even a little more complex, maybe a hypermature cataract with a dense vitreous hemorrhage following retinal detachment repair who just will not remain still on the table. Or maybe it's one that has the panel questioning the integrity of the posterior capsule throughout the case, the dreaded intralenticular ojordex. This video isn't about any of those. Now, the second type is the one that starts out so routinely, so normally, that you don't know what hit you until the case is over. Well, not trying to be a tease here, but this video isn't about those cases either. As a matter of fact, this video is about those cases you never want to go south, never want to be presented at a challenging case symposium. This video is about how you would want your surgery to proceed if it were your eye. And I know, because I've been there. I tell my patients I want them to be the least remembered. They want their cases to be exquisitely boring, deliciously dull, amazingly routine. The formula for this is rather straightforward. Good preoperative planning, precise instrumentation, attentive surgical skills, and technology that can handle the details for you. The J&J Vision WHITESTAR Signature Pro System has become the cornerstone of our operating room for handling those details just at the press of a button. In this case so far, there's nothing to suggest there should be an issue. Good sedation, great red reflex, no pre-existing pathology. Nothing we've identified that would impede a good outcome. As we complete the hydrodissection in this case, I'm pleased with the progress so far. Intact capsulotomy. The nucleus easily rotates. The nucleus didn't flip. I prefer a horizontal chop and use the chopper to stabilize the lens as I approach it with the phaco needle. In times past, I would have used the bevel up and impaled the nucleus with downward pressure. The beauty of the WHITESTAR Signature Pro system is that I am able to approach the nucleus bevel down, and by applying the force of peristaltic vacuum, I can draw the nucleus up onto my needle with the application of very little power and thus very little downward pressure. Ellipse FX technology then shows how effectively it chews through this relatively dense cataract. The simultaneous side-to-side and back-and-forth motion effectively prevents the cookie-cutter type occlusion we would see with standard longitudinal phaco. All the while, the technology profile of currently available phaco modalities. As one reviews the power graph, the innovative variable WHITESTAR software is titrating my power delivery. Instead of the depression of the foot pedal immediately generating excessive power, the power curve builds as I go into pedal position 3. In other words, my foot pedal depression feathers the power rise as I see necessary. For soft cataracts, a light touch. For rock-solid cataracts, a bit further depression. The beauty of this system is the universality. Now, for the last quadrant, the chamber stability is always in question. The aspirated emulsion is going to have tremendous variability in density, and the risk of chamber shallowing is always present. I'm not fast enough to respond instantly, but the occlusion sensing technology to the WHITESTAR Signature Pro system is. When the processors sense an occlusion, they hold the occlusion long enough to obtain a firm grip. Without any active perception on my part, the system reduces the vacuum to a safer level, one that can handle the emulsified fragment. With the foundation created, the implanted IOL can now function to its best intent. In this case, it is an Technis one-piece IOL. It could easily be a toric, or a multifocal, or an extended depth of focus lens. And the last task for this surgery, the removal of the viscoelastic. While this is an easily ignored step because it rarely results in a surgical mishap, the post-operative effects of inefficient viscoelastic removal become readily apparent. This is where the dual vacuum system is tremendously appreciated. I switched the WHITESTAR Signature Pro system to a Venturi mode for more efficient viscoelastic removal. The difference lies in the nature of the vacuum system. A peristaltic system requires an occlusion to create vacuum, and viscoelastic really cannot create an efficient occlusion. A Venturi system is continuously creating vacuum without an occlusion, making viscoelastic removal that much more thorough. And here it is. A centered IOL in a clear, intact posterior capsule with very low levels of expended power needed to remove the cataract. This patient is set up for a fantastic outcome. As the surgeon, I get to take all of the credit, but I couldn't have done it without everything happening in the background. The Johnson & Johnson Vision's WHITESTAR Signature Pro system is a cornerstone of the surgical plan.